Prime Minister Narendra Modi has warned the country about the rising danger of antimicrobial resistance, saying that antibiotics must never be taken without doctors' advice. Citing new data from the Indian Council of Medical Research, the Prime Minister said the growing habit of self-medication is making many infections harder and sometimes impossible to treat. The latest ICMR report shows routine antibiotics are rapidly losing effectiveness, especially against hospital infections, and India now carries one of the highest burdens of drug-resistant infections in the world. WHO data also shows resistance is rising globally, with 1 in 3 infections in India now resistant to commonly used antibiotics. Studies warn that more patients are carrying multi-drug resistant superbugs in community, increasing the risk during surgery, cancer treatment and routine hospital care. Doctors say that the message is simple: don't take antibiotics on your own, don't buy them over the counter, and always complete the full course when prescribed. Experts say India is at a critical point. Responsible antibiotic use is now essential to prevent common infections of today from becoming untreatable. Is this the real threat to all of us, the misuse and the habit of buying everything from the counter, not going to the doctor?
Thank you. I'm really grateful to Honorable Prime Minister for raising this issue to the masses. Considering the reach of Mann Ki Baat to millions of people from our country, it is both very timely and also the statement that he has given is very powerful. It is the reality of the situation today that people consume antibiotics, they indulge in self-medication without having proper advice or prescription from the doctors. As a result, there is overuse and misuse, or I would say irresponsible use of antibiotics in our country. And that is leading to emergence of drug-resistant pathogens, which are becoming very difficult to treat. The result is that the patients have to spend more money in treating these infections. They stay sick for the longer time, and sometimes it is not possible to cure these infections, and they result in the death of the patient. This is assuming alarming proportions in our country based on the data which is being collected through ICMR, AMR surveillance network in last 10 years. So Prime Minister's statement at this point should be taken very, very seriously, both by the prescribing community, that is the doctors, as well as the patients.
Madam, which are the areas in which these antibiotics are failing, in terms of resistance?
So it is basically the bugs or the pathogens which become resistant to antibiotics. And all the syndromes which are caused by these bugs, for example, urinary tract infections, respiratory infections, infections like typhoid, seriously ill patients who have bacterial sepsis. So this impacts all those patients who are having bacterial infections.
And, before I close in the show, which are the most misused antibiotics these days?
So there are certain third-generation cephalosporins. There are combination antibiotics like BLI inhibitors. So these are the broad-spectrum antibiotics which are most commonly misused. So that is something, for example, fluoroquinolones. These are the antibiotics which were commonly used to treat diarrhea. These were also commonly used to treat typhoid, but the overuse has resulted in almost 90% resistance to these antibiotics, and that has resulted in us physicians looking for alternate options to treat these syndromes.
Absolutely. Thank you. Thank you for joining me. I wish we could have had a longer conversation on this issue, but the Prime Minister speaking: do not buy antibiotics from the counter. Go to the doctor. If doctor says it, buy it, complete the course, or else stay away from it.